is a specialized accreditor. We focus on the deep dive with respect to medical travel programs, as opposed to the broad quality and patient safety infrastructure that clinical accreditors do, both national and international. Obviously, medical travel is much more complex, and it really requires that deep dive into the protocols and policies that medical travelers interact with as they embark on this journey. Our emphasis is on the patient's experience, as well as sustainable business practices and care management programs impacting medical travel patients and programs. During this time of crisis, GHA is working with our clients to share best practices. A few weeks ago, we spoke to 4 hospital leaders from around the globe who shared their strategies for mitigating and managing through the COVID-19 crisis. Right now, we are doing a 3-part series with 3 specialized ambulatory centers on 3 continents who are sharing their strategies for managing through the crisis. Today is our 2nd part of that series, and we are working with the Obesity Control Center, and very honored to work with our guest today, who is a world-renowned surgeon, Dr. Ortiz. Dr. Ortiz played a key role in the development and clinical application of implantable medical devices for weight loss surgery and is known around the globe for his work with lap band surgery. He is a leading authority in the field of bariatric surgery, including the gastric sleeve, the gastric bypass, and other bariatric surgery procedures, as well as his pioneering work with teenage population and bariatric surgery. Today, in addition to training surgeons around the globe in bariatric techniques, he serves as the medical director of the Obesity Control Center in Tijuana, Mexico. Welcome, Dr. Ortiz. We are very fortunate to have you with us today. Perhaps you might start by sharing a little bit about the Obesity Control Center and where your patients come from and what has been your history thus far.
I appreciate the introduction, kind introduction. So thank you for the invitation. We have been doing surgery for the past 25 years in the area of weight loss surgery. Weight loss surgery has advanced a lot. It started off as basically 1 or 2 procedures to lose weight. And we started in the early 90s to perform procedures that were, just like you mentioned, procedures very specifically designed, like the gastric banding. And then some other procedures came about, the gastric bypass, more or less at the same time, and then other procedures. But what we noted were several things. One of the most important things is that from a global perspective, the obesity became an epidemic and then a pandemic. Even in developing countries, we see malnourishment and obesity at the same time. Then over the years of past decade, we learned that obesity has not just implications on weight, but also on metabolic health, meaning that there's a direct impact on diabetes, on blood sugar, especially blood insulin, that then blood insulin will promote the tripling risk of cancer, heart disease, etc. So what we learned over the years is that what we're doing as surgeons is actually reverting a disease that has become a global healthcare or health risk for most societies. Mm-hmm. In fact, a recent study in the United States designated that only 12.2% of the US adult population is metabolically fit. So that's what we've been doing for 25 years, performing weight loss surgery, performing metabolic surgery, and 99% of our patients, even though we're in Baja, Mexico, Tijuana, just across the border from San Diego, California, we're receiving 99% of our patients from the US, Canada, and other parts of the world. So that's, in a nutshell, that's what we've been doing.
Well, thank you for sharing that. And what is the approach that both Mexico and the Obesity Control Center has used with respect to the pandemic, the COVID-19?
Well, early on during the first week or so of March, when we heard of the outbreak happening not just in Wuhan. By that time, it had spread to Europe, and there were initial cases being reported in the East Coast and West Coast of the United States. We took certain steps to obviously confront this head on and probably mitigate risk factors if at any possible. Because we're structured in a way where our database has full access to our patients before they even travel, we know who they are. We've got a clinical record on them. We've already studied them. They've already gone through the steps, including my multidisciplinary team, including my critical care specialist, my infectologist, etc. We know more or less what our patient population looks like before they travel. And one of the first things we did is we separated those that back then, with the information we had, we separated those that had a higher risk of having a disease or a severe disease or even death, which means the high risk patients, either diabetics, hypertensives, heart problems, etc. Having said that, basically most of our patients have excess weight and have metabolic disease. So it was something very that we had to work with uh, with much attention to be able to decide who could travel, who couldn't. And we're always in contact with them. Also, the other important thing is that we facilitated the process, having said to certain patients, you're not going to be able to travel, but as soon as this thing is over, you'll be put first in the queue and you will have your selection, etc. Also, the part of customer service is extremely important, and the situation regarding travel and reimbursements, etc. Even though all reimbursements from the airlines, because we're a completely out-of-pocket organization, cash pay.
Mhm.
The other thing we did is we asked our travelers, as we implemented certain protocols in the hospital where we immediately started using physical barriers for the micro droplet dispersion. In other words, everybody was using face masks in the health working environment. But we also ask the same of our traveling patients. So we have transport vans that pick up patients in the San Diego airport. Usually it's around 6 patients that travel or are picked up at any given moment. And what we designed was a system where the driver is fully protected. He's wearing gloves and a face mask. He's receiving the luggage. He's actually applying disinfectant to the areas that handles, etc. And as he places it in the hand, the second person receiving the patients are coming into the enclosed vehicle, but we started with a hand washing, hand disinfection protocol, and then immediately donned masks on everyone. It was a difficult decision because we're talking about early March, and of course, most information out there said the contrary. Do not use masks. They don't really work well to prevent disease. But with the understanding that as surgeons, we use masks as a barrier to prevent micro droplets falling on the surgical field, well, we applied that same logic to our patients, and it was actually well taken. Once they arrived, the masks were always placed on these patients, and we worked like that for around 7 to 8 days before we actually finally had to shut down operations.
Yeah. Well, during this period, as you are shut down, I'm sure there have been still a need to communicate and get information out to your patients, whether the prospective or current. What vehicles or mechanisms, are there any creative ways that you've been communicating with patients during this time? Sometimes the challenge presents an opportunity for new things.
Exactly, Karen. That's what we were talking before we started, a little bit about how things are going to change, and things are changing globally, and how we do business as healthcare professionals has also dramatically changed. A lot of my colleagues are now doing telemedicine, which was something that was frowned upon because of the non-personal nature of getting yourself on a webcam and talking to somebody. But at the end of the day, we're seeing that it is effective, and we can even provide better service sometimes than having the traditional way where you've got a waiting room and people waiting, et cetera, et cetera. So
Right.
this is a spectacular vehicle, which is online conferencing, cloud-based conferencing. I've been using, uh, for instance, one of the companies for over the past 5 years, and it's incredible to in the education platform. So what we've done
Mhm.
is that we've done several things which are really unique to our organization. Number one, since we have a lot of surgeons and physicians that are on call but are back at home, so what we've done is we've actually put them on call and put them on video calls. Right now, what we're offering is online counseling before uh, surgery, which basically means that these are prep consults, metabolic conditioning, and then after surgery for those patients that need some type of coaching. And this is done online right now. Internet is, well, everybody's suffering a little bit because of the bandwidth, and everybody's climbing on this bandwidth, but it's working fine. And this is what we call really uh, about quality and our commitment to the patient's ultimate well-being, even before they're actually our patients. The other thing we've been doing is we've been using social media,
Mhm.
and then a combination of cloud-based conferencing and social media, which I'll touch upon in a couple of seconds. So social media is extremely uh, well used at this point. Maybe 4 or 5 years ago, it was most of us as physicians were learning how to use the social media to get our message out. Right now, it's a systemized approach where all our branding, all our messages, all our campaigns are all across the board, from mailers, which everybody uses, or most everybody uses, um, and uh, our website, which has the same thing, and all of our social media uh, feeds via Twitter, Facebook, even YouTube. The other thing that we've done is we've used the ability of cloud-based conferencing and paired it up with our social media to do webinars, which is what you're doing now. And this was something that was extremely rare 3 or 4 years ago. But now most of these platforms, like the one we're using, WebEx or Zoom, they have the ability to interact with social media platforms like Facebook and YouTube and actually
Mhm.
stream to those platforms live as the conference progresses. So this is a very strong educational tool, which I've always said, I'm a soft marketer. I don't want to market the my price and the free pair of
Right.
Ginzu knives absolutely free of you act. Now we're all about education. The more the patient or the target audience sees us, the more they're comfortable with us, and the higher the probability that we're gonna end up being their provider.
Right. I absolutely agree with that. So you've really applied many different forms of communication and educating your population of prospective patients as well as your past pop, population. So that's great.
Yes.
With respect to telemedicine moving forward, I'm just curious, do you feel there are things that really need to be more regulated with respect to telemedicine? I know right now it certainly is, definitely has reached a tipping point with respect to its availability and its use and reaching and protecting physicians as well as patients from others. In one of our previous discussions, one of the physicians felt that there still needed to be some attention paid to telemedicine with respect to confidentiality and making sure that all the protocols were in place. And I'm just curious as to whether you share that or are there things that you worry about with respect to telemedicine. I'm not saying this to minimize its impact because I certainly think it is a technology that absolutely is here to stay and will be maximized and leveraged as we move forward, especially in medical travel. I think there's a lot that could be done with respect to medical travel, second opinions, follow-on care, the continuity of care, et cetera. Just curious as to how you think it might be applied moving forward.
Well, I would have to start off with using the example of my 15-year-old high school uh, daughter, which is now at home studying. And yesterday I had our one of our church groups get together via the web-based conferencing, and they were all talking. A couple of them are teachers, and they were all talking specifically about this thing regarding the privacy and how they can't be with one student, et cetera, et cetera. Then that's on one hand. On the other hand, we're listening to Zoom bombers now that actually can penetrate a call and then infiltrate one of the conferences and raise havoc.
Oh,
I believe that this whole privacy and then specializing of the platforms is going to be, if not already, it's going to be started very soon, because this opened so many doors and uncluttered the traditional way of providing healthcare. And these platforms themselves are extremely dynamic, and they're always looking for an opportunity to improve. So I believe there's going to be a highly specialized platform, either a new one or one of these with a specialized module that's directed to telemedicine,
yeah.
because you have seen over and over across the world, including the US, where the red tape and
Hmm.
all these requirements have been removed in order to get the provider to the person in need. And
Right.
all this red, you're seeing how licenses are being nationalized, and somebody
Mhm.
in
Right.
California can practice in the East Coast, et cetera, et cetera. I believe there's a lot of things that we're going to learn from this, and we're going to learn that certain things really don't matter that much for the patient's safety, and ultimately they create this convoluted system that's becomes a very ineffective, very slow delivery, very poor quality. I
Yeah.
believe this is going to expedite the way we provide healthcare, and definitely, obviously, one of the most important things is the patient's privacy. They're protecting their rights. This is why we're so excited all the time about accreditations and about sticking to them, because there's science behind this. But having said that, I believe people that are making policy are going to learn that a lot of this red tape can be removed and make our medical services much more effective, and a higher quality of service can be delivered if you remove those obstacles.
Absolutely. I share that feeling. I definitely feel that um, as we move forward, there's going to be pent up demand for elective surgeries such as what you provide, as well as obviously with with the huge economic costs, there's going to be probably increased insurance costs, increased costs that the patient will be paying with respect to their health care. So it's very likely, I assume, that patients will continue to look for more affordable care, more accessible care, and telemedicine can certainly help with respect to that. Um, as medical travel programs, and yours is certainly well established, globally known, what advice would you give to medical travel programs as they are in this, kind of a waitful period, knowing that, travel is restricted, that there might be a period of time when patients might be somewhat uneasy about traveling? What would you give advice to as far as what they should be doing now and what they need to do as travel restrictions are lifted to provide that confidence and trust to patients that it's okay to travel? I think the underlying motivation for travel, as I mentioned, for medical travel, will even increase in the next few years because of the this experience that we've had. But I
Yeah,
welcome your perspective.
I believe so, Karen. I believe that it's going to increase dramatically. A lot of the countries are going to be very hard hit. Their healthcare systems are going to be very hard hit. In our case, we're in Mexico. We're neighbors to the United States, and there's extremely high demand because of either the timeliness of care, the cost of care. I mean, we all know the list of why patients
Right.
travel internationally for procedures. I believe it's time to reboot. We have to reorganize our thoughts. We have to reorganize the way we think traditional medicine was provided. And because we are afforded these platforms that are extremely well designed, I believe that anyone who's in this field should start caring for delivering care for the patient at a distance. And
Mhm.
and in order to do that, you have to be an expert in all these platforms. And remember, the message goes out not just through telephone, it goes out through email, it goes out through social media platforms, it goes out through these specific cloud-based conferencing systems. One of the most important things I believe is you have to show who you are, what your philosophy is, what
Mhm.
you're about. Uh, there's an unfortunate fact, and we're going to find that in all the fields, including the medical field, that some organizations are going to compete with price. And that's an unfortunate fact because nothing else is going to be the driving factor except an extremely low price. But everybody knows when you cut corners, the patient is the one that suffers the consequences of less than ideal conditions for a procedure, a service, etc. I, I believe it's time to compete with quality. And I believe it's time to compete with your message. And I believe that the way you do it is by solidifying all your platforms and all branding them all across the board and creating one message that goes out through all these platforms and says, I'm here. This is what we're about. This is how we're going to take care of you. Only quality, only quality, and of course, quality equals safety, can give the traveling patient the reassurance, the 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 assurance that they are in safe hands and that they are going to a place that is time and tested, and that they're going into a community of people that have already undergone the same thing. That's another thing, that the ability of communities getting together and creating groups, creating online support groups in different types of platforms, those also reassure the patient. So basically, I've always said, don't market yourself. Just be a soft marketer. Educate people. Just educate them about your services, about who you are, about what you do, about anything you want to do, and the rest will naturally come.
So really you're advocating, I think, living your brand. If you live and show by your example what your brand represents, then people will understand that. And when you were talking about, quality and safety, I do think patient experience for medical travel is a major piece of that. And obviously the care and the way you've talked about all the attention to detail for your patients certainly also provides them assurance and trust in the obesity control center clinic, as far as knowing that there's someone there to pick them up. Not only that, during this time when you were first involved with them during the pandemic, providing them the assurance that they were in a safe, clean environment, protecting them from the virus to the extent that you could. I definitely think the patient experience and how patients view their interactions and how all of the encounters really along that medical travel care continuum are reviewed for potential risk opportunities as far as what could go wrong. And if they're not picked up or if their meals are not appropriate for the surgery, many hospitals that might perform bariatric surgery, if they're in a hotel that is not tied into what they need following surgery, that's a problem. So I think the patient experience is also paramount. But I certainly appreciate your joining us today, Dr. Ortiz. Is there anything else that before we close that you would like to share that you think is very important for medical travel programs, or critical at this point in time? I think what you've been doing has been very significant in keeping your patients informed and part of your brand right now.
I believe that during this COVID-19 pandemic, it's extremely important to keep informed. I mean, most of us are physicians. I mean, some are administrators, but most of us are physicians, or you have contact with physicians. It's extremely important to understand that this is not just ending abruptly. The aggressor is still out there. and there will be on uh, additional waves of infections until something permanent is found. And the permanent is either a medication or a vaccine or an immunoglobulin that's specifically designed to combat that. And we're still months away. So don't relax your discipline.
Mhm.
Once patients start traveling again, remember that there's this consensus now that what we're trying to do is lower the viral load in the ambience, in the environment. So everybody should wear masks. Why? Because the virus doesn't travel alone. It travels in micro droplets. And right now, as I'm speaking, I'm emitting micro droplets. And the best way to diminish those micro droplets is by putting a barrier between my emitter of micro droplets and the environment, which is a face mask. So just a word of caution: when you reinitiate uh, your operations, protect each other and protect the patient. What's going to happen? Maybe, hopefully, God willing, something in the near future, maybe weeks, maybe months, is going to resolve this problem. But if not, we're living in a new world. And in this new world, this may not be the only aggressor of an infectious nature that comes up. And we have to be prepared for it in the future as well.
Well, thank you very much, Dr. Ortiz. We really appreciate your participation on this webinar, and we invite our audience to go to our website. We have additional resources for COVID-19 specific to the medical travel program. We're really trying to target ways that we can help you sustain your business and to stimulate greater business when this is mitigated. But thank you very much for joining us. And our third part of the series will be Vila Clinic, and we will be promoting that as well, and we'll let everyone know when that is available. Thank you again, and stay well and stay healthy, all of you. Thank you, Dr. Ortiz.